Hey Marley,
Yeah.
the Crohn's and colitis community have a few questions about inflammatory enteropathic arthritis.
Okay.
What is it?
So enteropathic arthritis is a form of inflammatory arthritis that only affects people with IBD. It can affect them even if they've had the diseased part of their bowel removed, like me, who's got a stoma, and it typically lines up with the other autoimmune conditions that you have. It's long term and there isn't a fix for it at the moment.
Okay, interesting. So how did you find out that you had it?
Bit of a complex story. I had my surgery for my stoma and all of my ulcerative colitis meds were stopped, including biologics. And for a couple of months I was relatively okay until I started to notice joint pain and started to experience a lot of symptoms that were out of the blue. This then ended in me having a fall, which I went to urgent care for, and they checked me over and decided that I had fractured my elbow and torn my meniscus, which seemed like a very strange injury to have for the fall that I had, and told me to rest, and went through a couple of months of physiotherapy and things to try and help me. That didn't help, and in fact everything got worse and worse to the point where I couldn't move. So I ended up going to a different hospital, that being Southampton, where they admitted me and ran a lot of tests including x-rays and bloods, and realised that I did not in fact have the injuries they thought I had, that I'd been misdiagnosed with. I actually had enteropathic arthritis, and went on to then help me with some treatment options for that.
So have you been on any treatments for it?
Yes, so since July 2024, which is when I was diagnosed, I've been on 4 main types of treatment. The first one was cefalozine tablets. These are standardly given out when you have arthritis, although they weren't a lot of use to me because after a couple of months of taking them, the doctors realised that actually it won't work for me because they absorb in the part of the bowel I no longer have. So they were struck off the table, not carrying on with those. Then I went on to methotrexate injections, which I had to do at home myself. Again, very common as a treatment for arthritis, but unfortunately I became allergic to them and got very, very poorly, ended up being admitted into hospital again, and so I got taken off of that. The next thing I was put on was prednisone, so steroids, which are obviously not a long-term fix, and unfortunately I'm still taking a very high dose of those at the moment. They've got me back to a point where I'm able to function and to move, but that's been while I've been on the wait list for biologics, which is the 4th option I've been given. So I'm looking at going back onto infliximab, which should be happening as of next week via infusions at the hospital via IV, and hopefully they're going to help to get a grip of things, although there are some complications surrounding going back onto biologics when you've had a long break from them. So we're yet to see if that's actually going to work, and in the meantime I'm stuck on the prednisone with extremely bad moon face.
Apart from the moon face, have you had any other problems with taking steroids long term?
Yes, definitely. Steroids are not a good option long term, and because of my ulcerative colitis last year, followed by my arthritis this year, I've been on them far longer than I should have been. So I finally managed to get a DEXA scan a few weeks back, and unfortunately they have given me what's known as osteopenia, which is the precursors to osteoporosis, when your bone density starts to weaken and you start to have more issues. And for me, that's all happening in my left side, which happens to line up with the side that my arthritis affects most badly.
Do you have any other conditions that interact with the enteropathic arthritis?
Yes, I do. So outside of the ulcerative colitis, I also have hypermobile Ehlers-Danlos syndrome. So I get spontaneous dislocations and subluxes all the time. This is really tricky to manage with arthritis because if I do dislocate, it flares the arthritis in that joint. But equally, if I'm too inflamed, then I haven't got that free movement and I end up becoming very, very stiff. So it's quite the balancing act to try and find a way to manage all of these conditions at once.
You've also had some problems with your eyes.
Yes, I have. So a part of the autoimmune flare-ups I've been having, which are tied into the colitis and the arthritis and the general inflammation that I have everywhere, is that I've developed uveitis. So that's inflammation in my eyes. So again, in the autumn, I ended up admitted back into Southampton Hospital with severe issues with my eye, at the time my left one, where I had inflammation behind it that was actually pushing it forward and starting to cause it to hurt and have other issues. This is currently being managed with, you guessed it, steroids, which I have to use as drops in my eyes. Again, infliximab as a biologic should, as a side effect, actually help to treat my eyes, along with other bits and bobs that go with autoimmune conditions. But we shall see. There is no one path, and there are 13 different types of biologics. So if this one doesn't work, I might have to try another.